The move to level 1 of the lockdown in South Africa coincides with Tourism Month, which is commemorated in September. Borders will now be fully operational. Now, Limpopo has 2 borders with neighboring countries, Botswana and the gateway to Africa through Zimbabwe. The Limpopo Health Department believes there is a need to caution travelers about the risk of a second surge and the importance of continuing to adhere to all COVID-19 protocols under level 1. We are now joined by Limpopo Health MEC, Dr. Poppy Ramatuba, to discuss the importance of observing these protocols. MEC, thank you for joining us on the program.
Afternoon to all your viewers, and thank you for inviting us.
So we run the risk of becoming complacent as a country, which could spell disaster if we enter a second wave of this pandemic. What are your concerns as we enter level 1 of the lockdown?
I think what we have already observed since the president made that pronouncement is that people have become relaxed. People think probably we have got a vaccine. People think we probably have got treatment. Because as we move around our malls and we look at what is happening in our funerals, it's no longer the new normal that the president spoke about. People are no longer practicing social distance in our mall. What we used to have, probably a security guard at the entrance of the mall, sanitizing and checking if people are properly wearing their mask. It's no longer happening, and that is a big concern for us to say, yes, we are at level 1 lockdown, which does not necessarily mean the virus is gone. It simply means that we need to start living with the virus and doing the new normal, which is being strict in terms of our sanitization and also wearing of our mask. So that is a serious concern. And also as a province, we, as you have indicated, that we have noted that we are the home for vibrant tourism, if you have noted that. So we were busy. I was discussing with my counterpart, the MEC for Economic Development, and also the CEO for Tourism. They are also indicating we will be joining hands together with them so that we welcome all our tourists and Limpopo, as I've said to you, with this warm weather. It's a good air destination. But however, we just want to indicate that people must comply with the regulations. We will be working at the Port Health of the 2 borders, supporting our staff there to make sure that as you enter, you are having your results, which are less than 72 hours, that are negative. But you will understand the difficulty and the uniqueness of the type of some other visitors, especially you can't compare those who come through OR Tambo and those who come through Bait Bridge. The ones that come through Bait Bridge don't even have access to those testing facilities. So that is why, as the Department of Health, we've put up a team that is currently now working on how are we going to really deal with that particular unique situation. At the same time, strengthening our household community-based approach that look towards the surge that will be coming, to say, how do we empower individuals in their own household to make sure that even if your domestic worker has arrived back, how do you provide self-quarantine at home? How do you provide cleanliness in the sense of infection control? We are currently doing that work of teaching people at their own home to protect themselves.
Now, MEC, before I let you go, let's also discuss incidents of PPEs and COVID-19 related fraud and corruption in the province. How has the province responded, and what are you doing to ensure that those implicated in fraud and corruption are found and brought to book?
I think we must appreciate the fact that immediately when these news were broken, the Premier immediately requested, together with us, that we allow the law enforcement agency to investigate any single allegations, which does not necessarily mean that that is true. For instance, the article that even today continue, the paper that continue to repeat that We have spent more than 932 million on PPEs, which is something that already Treasury has shown that we have spent far much more less than that, even the whole province combined its budget. We have also seen that the Auditor General in their first report, which they've already presented to us and also presented, the AG presented to the public, it's there for public consumption. It has shown that Limpopo is one of those provinces that has performed according to the laws. If you look at all our prices, there is no single item that has been procured above the Treasury note that has been provided. If you also look at the lead times, you will see that Limpopo had a process that says if you are given a contract, that contract will indicate that you will deliver at this particular time on this particular date. If you exceed your contract, automatically it's cancelled. So if you look at the expenditure on the quarantine side, it's still zero. So you can go through the AG report, which has shown that there's no single irregularity up to so far. We are again waiting for the SIU report. If there is any wrongdoing that could be picked up by those institutions, we definitely will have to act. But you cannot act based on rumors or based on an institution that is not capacitated to do the investigations. So up to so far, our Chapter 9 institutions are also busy with this investigation. The public protector also had come on board to say they would want to investigate these allegations. So we are giving them that opportunity and that space. While we welcome the first report from the AG, we are also waiting for the second phase, which will be presented next month, as the AG has already indicated. But up to so far, from where I'm sitting, those institutions that have presented the reports to me, we have not picked up any wrongdoing. That is why you see that we have not yet acted on anyone. We are waiting for all these institutions. Should there be any wrongdoing, action will definitely have to, according to the law that is there.